Hi everyone. So we are back again. We are back again with Dr. Madeline, and in the second part, we'll be discussing more about questions related to equine veterinary medicines, and also like follow up questions related to soft skills and attribute. Uh, Welcome again, ma'am.
Thank you.
Uh,
Ma'am, so far we have discussed about the profession, the industry inside, but how do you see the future of equine veterinary medicine evolving in the next, let's say, 5 years?
Um, a lot of a lot of evolving is already happening. For example, with artificial intelligence, it's the new diagnostic imaging and also diagnostics. Simply, we've seen videos of those big um, clinics that are known worldwide that are evolving and creating groups. For example, Equitom, amazing what they are doing. Also, they are involving artificial intelligence in their work, which is very cool. Or watching a CT scan through virtual reality machine on their
Hmm.
on their head is cool, but it's evolving. It's evolving, and now we have more solutions to a variety of problems that 10 years or 15 years ago they did not have the solutions for. Problems with the articulation, articular cysts, etc. They invented screws that are made from biomaterial that they can put the screw in and then it will disintegrate by itself. This is really interesting and really um, evolving, let's say. So yeah, everything happens for a reason, and what's happening right now, it will be evolved or and will have very nice positive consequences on many levels in equine medicine
yeah,
or
I,
equine
I
field.
I completely agree with you. I guess when veterinary profession was studying started like in past, I guess no one has imagined that there would be like some technologies like AI or artificial intelligence doing diagnosis. And I guess like in past also they haven't imagined that there would be the diagnostic tools like USG or microscope. So I see that
Yeah,
changes are necessaries, and I also feel like with the help of AI we'll be able to take our professions into the next level. So ma'am, like
yes, indeed. Not we don't have to start switching our profession with AI. This is very
Hmm.
important to know how to
Hmm.
use it, but do not
Rely
switch
on
it
it.
with AI.
yes.
Still need our brains, but yeah, it's a lot of um let's say
Okay, ma'am.
um,
So I'd like to personally like hear your insights and advice, like your personal advice. How was it while you were working internationally? For example, when we are working in IVSA, it has given us a lot of opportunity to shape ourselves as a person and also to help us grow ourselves in our professional life. So how has working internationally shaped your personal and professional growth?
um it's very important to be able to be integrated in the international community. Like I've said before, we are always um, each one of us have their own experience, their own habits, but we have to know how to accept the other person and how to learn from the other person. As
Hmm.
in equine industry, the veterinarians think that each vet, and I've seen it, I've experienced it personally, that each vet thinks that they are the best. They don't take advice from the other, and they do their work with no cooperation, no collaboration, no give and take, talk, share the experience, share your method. If I do this, it doesn't mean that you can't do another method that is maybe better, or my method would be better. So um, it helped me to recognize that other people also have nice experiences and knowledge that they can share. And as well for me, I have my own experience and I have my own knowledge that I can share. This is what I'm doing with you, for example. So yes, being modest, being patient, and being um, open, to have an open mind to everything. This is what the being integrated in the international community gave me. I can say that, yeah.
That's so great to hear, ma'am. So you said that you wanted to be equine veterinarian since you were a child.
Yes.
So what is the most rewarding aspect of your job you think right now?
What is the most what? Sorry, I did not hear.
Rewarding aspect, rewarding aspect of your job.
Rewarding aspect of my job. Honestly, it has nothing to do with the job itself, but ambulatory medicine, and especially where I live now in France, it's gorgeous. I love being out in the car, and I love driving from one stable to another, looking at nature. I'm always surrounded by nature. I love that. Horses here, the owners are great. The horses are great. They are nice horses. In Belgium, they were not always nice. Uh, and the most rewarding about my job right now is also um, being able to work with other vets worldwide and being able to help other vets and students like you right now. This is the most rewarding thing about my job, because my experience and what I did in my life allowed me to have to to appreciate what I had from where I came and where I become, where I am right now. I just would like to help everyone have the same thing, even if they are not actually in France. Or so the most rewarding thing about my job and my whole experience is this, actually. Ah.
It's like so, and I'm so glad everyone who will be listening to this veterinary profession podcast will be so glad that you are here sharing your journey with us, ma'am. If you could go back in time, is there anything that you would do differently in your career? Because most of the time we believe that if only I would have done this instead of that.
Yeah. Um, uh, if I can do something differently. Yeah, we always say maybe if I worked harder here, I would have been better in this. Or if I don't know, went to this facility instead of the other, maybe I would have had more chances there. Um, but honestly, looking at where I am right now, where I live, where I've become, where I've come really far from where I was when I was a student in Lebanon, I wouldn't change a thing. I would not.
That's very sweet of you, ma'am. Like, for
I was very
whenever we
lucky.
are,
I wouldn't
yeah,
change.
whenever we are talking with persons, not just with the professions, like whenever we are just discussing about something, I guess like we always have few moments like where we want to change something, but sticking with like obviously if I'm talking by myself, I believe that there are a lot of like decision in my life. If I would be able to change, I would change, but being a veterinarian or is choosing a veterinary medicines is the only thing that I won't change. So
Yeah,
I'm really like
exactly.
glad to
Yes.
know your perspective over here too. So ma'am, like when we are talking about working on international platform, I believe like the communications barrier would might have been a bigger challenges when you have started. your career, like while you're working with while you moved back from Lebanon to France, and also like you are working with Nigeria at the moment. So how are you able to manage this? Because for me, also like within IVSA we have a lot of members representing from all white, so it had been a problem for us to work together. So what would be your suggestions if you would like to combine that with IVSA, and also how you have been able to tackle the challenges in your personal life?
Um, it's true that you are talking about communication, right? Yes.
Yes, ma'am.
It's very difficult. It was
Yes,
very
ma'am.
difficult for me. Even, for example, I speak French from like when I was 2 years old. I speak French. We learn French and English early in schools in Lebanon. So I speak three languages: Arabic, French, and English. But understanding not the only the
Hmm.
language, but the meaning, the intention behind it
Yes.
was very hard. And France is not a foreign country to Lebanon, you
Hmm.
know, but it was very different. So for me, being able to fit in at first, it was hard in France. The first year it was hard, even with my co-interns. It was at the end of the internship year that I started to really be able to really express and feel myself and understand what they mean, because there's a slang in French that sometimes they speak in
Hmm.
slang language. So it was I don't understand slang language. I only understand literature French. So
Hmm.
yes, it's different. Um, but the discipline, I think, when we are in an international community, for me personally, I'm always interested by the culture of the other people. So French people, I used to do what they do. So
Okay.
if they want to go out, do this because French people do this. We used to do it, and then I understood and I try to enjoy what what their habits are. A lot of partying, a lot of drinking, not good practice. But sadly, in college, first year, this is what it is. uh, but I had friends from Thailand that once they invited me for dinner and we ate
Hmm.
real, really delicious Thailandese food. I don't know how to Thai food. It was great, and even I once cooked for um, for my fellow colleagues Lebanese food. It was nice. So you have to be patient and to try to fit in and to respect the culture of
Hmm.
the other person, because we don't all come from the same background. So
Hmm.
sometimes you have to be polite. I don't
Hmm.
know. These are basic manners. So
Hmm.
in Nigeria, I speaking the language they speak English, so communication was not a problem. Just like we are communicating now. You are from India, I'm guessing, or Philippines, no?
Yes, ma'am.
I'm from
No,
Nepal.
India and Nepal.
Nepal, voila. So we are speaking through internet, but we understand each other. So Nigeria is like that, and Lebanon is a big problem because remember when I said the international community, they think that they are the best at what they do, and they don't like to be modest and share. Lebanon is
Hmm.
like that, sadly.
Hmm.
The vets there, not all, but voila, some of the vets there, and some of the owners, they think they know more than the vet. So also you have to learn how to be modest, to be cool, give and take, make conversation, explain, and then the other person will understand. Sometimes they don't understand. So yeah, international community, you have to be patient. You have to try to fit in and respect the others, because otherwise you are international. You're not like
Yes.
the
Hmm.
other person. You don't have the same
Hmm.
culture.
So
Hmm.
for you, the knowing about the cultures, or basically like understanding the cultural sensitivity, communicating with them, and trying to work with them had helped you to establish the communications while you were working internationally. And within this, like you mentioned about difficult clients. So I guess like you have also faced this situation. So can you elaborate within these situations, like how you were able to handle a difficult client, especially with the communications models? If you have any examples, then that would help us a bit.
Um, I don't know what to say. Uh, so give you a like an advice on how to communicate better. This is
Yeah,
what you.
just to communicate
Hmm.
better with like difficult clients. You mentioned that Lebanon has a situations where mostly when we are talking about like clients, we also have, I guess like it's same for Nepal and also same for India. We also have some farmers or clients like who
Hmm.
guess like they have a knowledge and they
Hmm.
don't tends to like take advice from veterinarians,
Hmm.
and they think like whatever they are doing are right for the pets even though that is not. So within these situations, like how would you handle the communications with
Yes.
them or make sure that they are following your advice?
Um, how I handle things is that I try to find a middle solution between my method and their method. So, because I always keep in my mind our grandfathers and the old people that we know, they managed to treat their horses.
Hmm.
Nevertheless, even
Yes.
they were not doctors, they were not. So those people, it's hard to change their habits. So what I usually do is that find a middle solution, use their methods, but a bit uh, more evolution, more science behind it, more recent uh, methods, if you want.
Hmm.
And when they see that my methods work, they start trusting me
Hmm.
because it's reality. Old methods cannot stay. Uh, I mean, they are precious, but we cannot just use them in 2025. We have new methods, we have new medicine, we have new technology, and we have new doctors, so more specialized doctors. So we are here to help them. I make them understand that I am here to help them.
Hmm.
It's not because my fees are not expensive or it's more expensive than what they usually pay, for example. It's not the case, but I also aboard the subject. It's not just financial. It's not. I am here to help. I
Hmm.
am here to help the farmers, the horse owners, the horses, and the Lebanese community. So they all succumb to this. They all agree. They all agree. They like this method. They from their point of view, they see a vet that really cares and that is willing to also work with them and not oblige a certain method or just say,
Hmm.
okay, you I leave you alone, you do whatever you want, I am out, for example. It's not like that.
Hmm.
So basically,
So
not ignoring their opinion.
no,
Hmm.
never, never,
Also
never.
like keeping your opinion in the same platform so that you both agree and seeing the procedure that best fit for the animal. So this is the
Hmm.
best situation that we can go with if we need to handle like difficult clients.
Of course.
So,
Exactly.
ma'am, like, I think we are toward the end of the sessions. Before moving toward the end, and like Akirti would go with the other questions, I still want to like raise the questions because just a one question at the last. So you when you were thinking about like specializing in equine veterinary medicines, did you had any mentors, or were there any persons that you used to follow up on, look up on, uh, and
Yes,
also
of
like
course.
from someone who used to guide you within that field? If yes, how?
Yes, of course. Especially in my first year in Lyon. I used to, I was a very quiet person and a bit shy. I was a bit also not used to. I was under a lot of pressure because I wanted to prove myself that even if I
Hmm.
come from a different country, that I'm up to the level. So, um, what I did was also always take notes about the comments of the professors when they want something to be done like this, or when they want us to present the round in this certain manner or anything. I used to take notes and I used to do what they want. I always looked up to the residents because their job was tough, 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 tough. Residents, even more than interns, I think, because interns we were very numerous. We were 10 interns in the whole in Lyon. We were 10 interns, and the residents there were two residents in internal medicine and two residents in surgery, and they do enormous work. And I always looked up to them, try to be as persevere, to persevere as much as they do, and of course the professors, what they have done in their life is very impressive, that you just don't want to let them down. It's very simple. It's like they are great, you are here, you are aware of the situation that you are in and how privileged you are.
Hmm.
You just want to do your best, and you
Hmm.
start to look up to anyone that you can,
Hmm.
that is a bit nice to you and give you advice. And I looked up to everyone, even my co-interns, when
Hmm.
they present a paper in a certain manner. I'm like, they are great. I want to present like this, for example. It's
Hmm.
So you
So
took
so
best from
basically,
yeah,
everyone.
basically getting any opportunity
almost
that you
everyone.
take.
Hmm.
Hmm. So, ma'am, my last question. You wanted to be an equine veterinarian since you were a child, but what would be your advice for the young veterinarians who are still exploring their career paths? Like they're not really sure what they want to
Yes.
specialize in.
Hi, Dr. Madeline. Can you hear us?
See, I think it's the network.
Okay, I'm muting it.